Welcome to all. Myself, Sajitra, lecturer of Emmanuel Arasa College of Pharmacy. Today, I am going to present about pharmacology of leprosy. This topic covers the leprosy disease and its causes, and mainly it covers the drugs used in the treatment of leprosy. Leprosy is a chronic infectious disease which is caused by the bacterium by Mycobacterium leprae. It mainly affects the skin, peripheral nerves, and upper respiratory tract mucosa. If the leprosy is untreated, it will form the permanent deformities and permanent disabilities, and this leads to the loss of sensation and the skin also. And then the etiology of the leprosy. The leprosy was mainly caused due to the microorganism Mycobacterium leprae. Mycobacterium leprae is an acid-fast bacillus, which means it retains its strains even after the acid wash. Mycobacterium leprae is very slow growing organism, and the Mycobacterium leprae which can't be able to cultured in a artificial medium, and it makes the diagnosis and research difficult because the Mycobacterium leprae will not able to culture in the artificial medium. And then transmission, transmission of the leprae. The leprosy spread mainly through the respiratory droplets. The respiratory droplets means the infected patient's droplets, leprosy patient's droplets, which causes the leprosy. And prolonged contact or close contact with them also causes leprosy. So leprosy, this Mycobacterium leprae will transmit through respiratory droplets or prolonged contact with these microorganisms, but it is not highly contagious. So casual contact usually does not cause or spread this leprosy disease. Classification of the leprosy. Leprosy was classified into two main classes, which is this leprosy is classified according to the WHO, WHO means World Health Organization, and according to the classification of rightly Jobling classification. Further, WHO classification is further classified into two types. They are bacillary classification and multi-bacillary classification. Bacillary classification means 1 to 5 lesions, and then multi-bacillary classification means more than 5 lesions. Then second classification of this leprosy is Ridley-Jobling classification. This Ridley-Jobling classification is further classified into three main classes. They are tuberculoid classification, borderline classification, and lepromatous classification. This classification depends on the patient's immune response. If patient immune response is high, the occurrence of this leprosy disease will be low. If the patient immune response is low, this occurrence of leprosy disease will be high. Then, pathophysiology of the leprosy disease. The bacteria invade macrophages and Schwann cells. Schwann cells means nothing but it means nerve cells, because nerve cells plays an important role in the leprosy. That means loss of sensation is the main clinical future for this or main symptoms for this leprosy disease. So, nerve cells plays an important role in this leprosy disease. The immune response determine the severity of this leprosy disease. If there will be a strong immune, the occurrence of this disease will be mild. If the immune will be weak, there is a high chance for the occurrence of this leprosy disease, which means weak immunity, which leads to severe disease, and the strong immunity, which leads to mild leprosy disease. Nerve damage is the most important features for this leprosy disease because it leads to loss of sensation. If our body became a loss of sensation, we can't able to understand what will happen around us because sensation is the main factor for our day-to-day life. Clinical features. Clinical features for this leprotic patients. The leprosy acquired patients develop a hypopigmented or reddish patches on the skin. There is a loss of sensation in these patches. Other features which include thickened nerves or muscle weakness, and in some advanced cases there will be a deformities will be occur in a advanced cases. And loss of sensation is the key diagnostic features. If the leprosy will be in a high severe condition or high concentration, the deformities will be permanent. This, uh, this leprosy will cause a permanent deformities and permanent disabilities and permanent loss of sensation of our skin. Diagnosis for this diagnosis for this leprosy. Diagnosis is mainly based on clinical examination like physical appearance or further other clinical examinations like blood test, etc. And there will be a confirmatory test for this leprosy is skin smear test. It is a main test for the confirmation of leprosy. And there will be a one test that is known as lepromine test. Lepromine test is not for the diagnosis of leprosy. It is mainly used for the classification of leprosy. What type of leprosy will occur as lepromine test is mainly for a used for a classification of leprosy, but it is not used for diagnosis. And then pharmacological treatment of leprosy. Pharmacological treatment, the main pharmacological treatment which is used for leprosy is multi-drug therapy. In short, it is known as MDT. Multiple drug therapy means combination of more than two drugs, which is known as multiple drug therapy. This multiple drug therapy is recommended by the World Health Organization. The main drugs which involved in the treatment of leprosy is dapsone, rifampicin, clofazimine. These three drugs are mainly used for the treatment and prevention of leprosy. The combination therapy is used to prevent resistance. Why we use combination therapy means it will prevent the resistance. It will resist the bacterial growth easily. Then we have to see the individual activity side effects of these MDT drugs. First, we see about dapsone. Dapsone is a sulfone antibiotics. The dapsone is mainly used for this leprosy. And the core action of dapsone is this dapsone, which inhibits the folic acid synthesis in bacteria. Folic acid synthesis is required for the bacterial growth. So, this dapsone, which inhibits the folic acid synthesis. And dapsone structure is similar to PABA. PABA means para-amino benzoic acid. Then this dapsone compete with this PBA. PBA is important for the synthesis of hydroxysteroid synthesis. So this dapsone which compete with the PBA. PBA means para-amino benzoic acid. Then this dapsone will inhibit the dihydroxysteroid synthesis. This inhibition which leads to the blockage of the formation of dihydrofolic acid. This dihydrofolic acid is important for the synthesis of purines. This purine synthesis is important for the DNA synthesis of bacteria. So if the dapsone will block the dihydrofolic acid synthesis, it will automatically prevent the synthesis of purines. If the synthesis of purine is blocked or prevented or inhibited, the DNA synthesis of the bacteria will also inhibited. This leads to the bacteria can't able to multiply. So this dapsone produce a bacteriostatic effect, which means this dapsone inhibit the multiplication of bacteria. And then selective for bacteria, because human do not synthesize the folic acid. So this dapsone is selective for the bacteria. Resistance can occur if used alone. Then the resistance will also occur if we use this dapsone as alone. So this dapsone will used for the combination therapy. If the dapsone is combined with another drugs like rifampicin, clofamicin, it will enhance the action of the dapsone and the activity will also increase. And then we have to see about rifampicin. Rifampicin is a highly bactericidal drugs. Bactericidal drugs means it leads to the bacterial death. Dapsone is a bacteriostatic drugs, which means dapsone are able to mm, prevent the multiplication of bacteria, but rifampicin will kill the bacteria. So rifampicin is known as highly bactericidal drugs. The core action of rifampicin is, which means the main mechanism of action of rifampicin is which inhibit the RNA synthesis. That is, it binds to the beta subunits of DNA dependent RNA polymerase. Rifampicin will able to inhibit the RNA synthesis through it binds to the beta subunit of DNA dependent RNA polymerase. It blocks the transcription process. And this blockage of transcription process, which leads to the prevention of the formation of mRNA. So there is no formation of mRNA, which leads to the stoppage of protein synthesis. If there is no synthesis of proteins, it automatically leads to the bacterial death. That means it leads to the bacteria lysis. So, in the administration of rifampicin, it leads to the bacterial death. And this rifampicin kills more than 99% of bacilli in a single dose. So rifampicin is a highly effective drug for this leprosy. And so it is most commonly taken in a multiple drug therapy for the enhancement of the activity. Then we have to see about the final drug, clofazimine. Clofazimine is a antimicrobial and it is a very good anti-inflammatory drug. It has dual actions. Clofazimine has a dual actions like antimicrobial and anti-inflammatory action. The mechanism of action of clofazimine is it binds to the bacterial DNA. It binds to the bacterial DNA and interferes with the replication and transcription. It generates the reactive oxygen species, which means ROS. ROS means reactive oxygen species. In the generation of reactive oxygen species, it leads to bacterial damage. So, in case of bacterial damage, the cell is not able to live for long period. And this bacterial damage leads to bacterial lysis only. And this clofazimine has a anti-inflammatory action also. This the mechanism action of anti-inflammatory action is it inhibits the neutrophil migration and then and it reduces the release of inflammatory mediators. And these two combined effect which leads to slow bactericidal effect. This clofazimine, which is useful in Lepre reaction, especially type 2 reaction. This Lepre reaction in clofazimine is most commonly used in the type 2 Lepre reaction. And there will be a major side effects for this clofazimine is skin decoloration. Skin decoloration and gastrointestinal disturbance is a major side effect for clofazimine. And we have to see about the major side effect for dapsone and rifampicin. Major side effect for rifampicin is hepatotoxicity and red-orange color decoloration of um, body fluids. This rifampicin will cause red or orange color of our body fluids, such as at the time of administration of this rifampicin leads to discoloration of tears, and urine may be caused. This is a common symptoms. Our tears and urine will change in a red or orange color. And the common side effect of dapsone is hemolysis. Hemolysis is a major side effect for this dapsone. And then we have to see about the MDT regimen. That means who MDT regimens, World Health Organization's multi-drug therapy regimens, which means in which for which leprosy classification we have to administrate which types of drugs for how much period, how much months or how much days, like that. uh, there will be two main classes for WHO classification. They are paucibacillary and multibacillary. Paucibacillary classification, we have to take rifampicin and dapsone as a combined drugs for 6 months. We have to take this therapy for up to 6 months. And then second classification is multibacillary cases. For multibacillary classification, we have to take rifampicin, dapsone, and clofazimine as a combined drugs. And it have been given for 12 months. So these are the period for the administration of drugs according to WHO classification. This treatment duration depends on disease severity. If the disease severity is high, it will be prolonged for some other months also. If the disease severity is less, it will be administered in less period of time. Then drug resistance. Drug resistance is a rare but can occur due to irregular treatment. If the drug resistance will cause the activity for the drug is reduced, so we will not able to get a full bio effect of the drug. That means we will not able to get a therapeutic use of the drug completely. So drug resistance is a important factor in this leprosy treatment. Rifampicin has a most serious resistance. So we have to uh, know a drug resistance for better activity of the drug. And then we have to see a important reaction, that is Lepre reaction. This Lepre reaction is classified into two types, that is type 1 reaction and type 2 reaction. These Lepre reaction are immune mediated complications. It is not due to drug failure. It is a immune mediated complications only. When we take a multiple drug therapy, there is a immune complication will occur. This is known as, that reaction is known as Lepre reaction. This Lepre reaction does not cause due to drug failure. This Lepre reaction is classified into two types, that is type 1 reaction and type 2 reaction. Type 1 reaction, which is also known as reversal reaction, it is caused due to sudden increase in cell mediated immunity. This is the major cause of this reversal reaction. Pathogenesis of this type 1 reaction: activation of T cells, increased cytokinase, inflammation in existing lesions and nerves. And the features of this type 1 reaction: redness and swelling of skin lesions, painful and enlarged nerves, loss of nerve functions, such as there will be a loss of sensory and motor nerve functions. Risk: permanent nerve damage will occur due to type 1 reaction. Treatment for this type 1 reaction: corticosteroids are most commonly used for this type 1 reaction. In corticosteroids, most commonly we use prednisolone. This is due to increased immunity causing inflammation. Type 2 reaction. It is caused due to immune complex mediator reaction and occurs mainly in multibacillary cases. That means lepromatous cases. This type 2 reaction is also known as erythema nodosum leprosum, which means ENL reactions. Pathogenesis of this erythema nodosum leprosum: antigen antibody complex formation, deposition in tissues, activation of complement system, etc. Features of this type 2 reaction: painful reactions, fever, joint pains, eye involvement, etc. Systematic involvements: kidney, testis, etc. Treatment. Treatment for this type 2 reaction is thalidomide. The first choice of this drug for this reaction is thalidomide. And then for mild cases, they will use clofazimine. For mild cases, clofazimine is administered as for this type 2 reactions. But most commonly used thalidomide as a drug of choice. This is an immune complex reaction affecting multiple organisms. Difference between these two type 1 and type 2 reaction. Mechanism of action of type 1 reaction is cell mediated immunity, but mechanism of action of type 2 is immune complex. And this type 1 reaction occurs in borderline classification, and this type 2 will occurs in lepromatous. The lesions for type 1 reaction will be existing lesions inflamed, but type 2 reaction has new nodules. The nerve damage for type 1 reaction is severe, but nerve damage for type 2 reaction moderate. And then the treatment of type and then treatment of type 1 reaction is we use corticosteroids, especially prednisolone, and for type 2 reaction we use thalidomide. Prevention. The prevention for this leprosy is early diagnosis and treatment, and then contact screening and use BCG vaccinations, which provides partial protection for this leprosy. So prevention for this leprosy must be taken. It should be reduced by half. Prevention includes early diagnosis and treatment also. If we diagnose the leprosy at a early condition, and we will avoid the severity of the leprosy. And then public health importance. Should give a awareness about leprosy to the public. For many countries, they provide a free awareness programs for people. Free MDT is provided under government programs. Leprosy is still common in developing countries also. Leprosy plays an important role in a widely spreadable disease also, because it will spread due to a respiratory droplets of the patients also. So everyone should have an awareness about this leprosy. And the conclusion of this part: leprosy is a curable disease, but it is a spreadable disease also. So we should have a knowledge about this leprosy, and we should follow a program. We should follow a many hygienic things to avoid this leprosy. And early treatment prevents the disabilities. Early treatment of the leprosy can also prevent the disabilities and deformities, which also are prevented. Multiple drug therapy is highly effective. We should know about the multiple drug therapy, because multiple drug therapy is more effective than a alone drug therapy. In case of multiple drug therapy, one drug is used for bactericidal and one drug is used for bacteriostatic. So at the same time, there will be a dual action, like the bacterial cell will not able to multiply, and the bacterial cell will also death at a time. So we should have a knowledge about multiple drug therapy. is the today class about leprosy, and thank you for your attention.